Now, as we told you recently, Singapore is looking to build up a core group of professionals in the social service sector to meet increasing needs. But not all of them can come from here. Some voluntary welfare organisations are looking abroad to hire workers from Hong Kong and Taiwan. Imelda Saad has more.
Gwen Sung came to Singapore from Hong Kong to work as a medical social worker 3 years ago. Public hospitals here have been sourcing such workers from economies like Taiwan and Hong Kong for some years now. Given the nature of the job, Gwen says adapting to the local system, culture and habits was of utmost importance when she first started.
As a social worker, we need to know about the local people life here. This is the reason why I always keep myself open to make new friends. They are also from different cultural backgrounds. Some is from Malay, some is India. After to get in touch with them, I will know about some of the cultural taboo.
The Health Ministry said 14% of its nearly 400 medical social workers are foreigners. They're either from Hong Kong, Taiwan or Malaysia. Now, voluntary welfare organisations or VWOs too are looking overseas to hire social workers. Representatives from 4 VWOs went to Hong Kong in late March to source for potential candidates. Hong Kong has about 600 to 700 social work graduates each year compared to just 200 to 300 in Singapore.
In terms of their training and their social work education, they are quite a lot ahead of Singapore. I think they've been around for more than 50 years or more. So if you look at the family service centre scene in Singapore, it's about 20 over years.
The National Council for Social Service says Singapore still needs to look outside, even as it beefs up its local manpower capacity within the social service sector. That's because demand for social services is set to increase as the population ages, and for now, the country isn't churning enough professionals.
We hope that through the different schemes that we have in place, we will be able to attract more and more Singaporeans to come into this sector. But as you know, the need of the sector will increase, and so the question before us is whether we are able to keep pace with the need. And if we can't, then clearly we may need to look at alternative sources.
To help such workers adapt to the sector here, the Health Ministry provides support and training to its medical social workers. For example, assigning them a buddy and providing close supervision during the initial period to help familiarise them with the local social assistance and welfare schemes in Singapore.